As far as I know, actually, till now there is no such device. But actually, myself actually is collaborating with IIT Delhi to develop such stent. Maybe in a year or so, we'll be able to manufacture some prototype so that we can be launched. Okay. And in the meantime, also there are so many companies which are already into, because Make in India is a buzzword now, and all are, and maybe in the 1 or 2 years we will get to see most of the stents and balloons will be made by the Indian companies.
Working in KEM Hospital, Mumbai, and I was working with my colleague Dr. Kranti Kumar Rathod, and together we have devised a medical stent which will reduce obesity. And this design of the stent was approved by the US Patent Office, and we have been granted the US patent for this medical device to reduce weight in obese patients in April 2021. Once we have got the patent, we will further upscale it and see to it that whether this device is feasible, whether this device can be manufactured, whether this device will help us in minimally treating patients with morbid obesity. This is the only case that I know of a medical device which has been approved by US Patent Office till now amongst our interventional radiologists. There are many more in pipeline, and which we would subsequently see to it that we mentor each other and develop such devices in future.
We have probably the only device in the world which was manufactured and designed by an Indian company and Indian doctors, and I was incidentally involved in the whole study project. This is a device which is what we call as bioresorbable stent, and that stent, the important criteria was that there was a drug on it also. So that helps to treat this peripheral vascular disease, and we were the first people in the world which we used it in humans, and that paper was accepted in Germany and in Paris, where we presented our data, and is now acceptable, and now it will be all on a manufacturing front, and within a year or so this will be available not only in India but all over the world. So credit goes to that the Indian brains and Indian minds have worked on it and have been successful in treating these patients.
Okay, great.
Bioresorbable drug coated stent.
Okay, that is the name of the device?
So the name of the device is Credence BTK.
Which says that Tata is the best training institute in the world for something like this?
Yes, I think Suresh would be the best person to answer this. He is heading that Tata Institute, and is the head of radiology also.
So regarding especially the training in interventional radiology, Tata Hospital is the first institute which has got a 3-year Medical Council of India certified DM in interventional radiology course. So we started around 4 years back. We started with 2 seats in DM in interventional radiology, and recently we got approval from the National Medical Council, which is now MCI has been replaced by National Medical Council. It has approved 4 seats of DM in interventional radiology, which is the first institute in India for training the students after MD in interventional radiology. Similarly, Tata Hospital also has 2-year dedicated fellowship course in interventional radiology, which has been affiliated to Homi Bhabha National University, which is a deemed university under which Department of Atomic Energy runs various teaching courses. So under that university we have a 2-year HBNI intervention radiology fellowship course, and we also have 1-year certificate course of Tata Memorial Center itself in intervention radiology. So at any time there are 10 to 12 fellows who are getting trained in intervention radiology in Tata Memorial Hospital, and that is probably one of the highest number of students which are getting trained in intervention radiology, and that is why I am sure Dr. Hemant Deshmukh has said that it is one of the leading institutes, and it also has collaboration with international institutes like King's Medical College, London, as well as Miami Cancer Center in Florida. So we have affiliations with such international institutes as well. So one of the best training is given in intervention radiology in Tata Memorial Hospital.
So what do these studies reveal?
So this will what we call as registry data. Rather than the industry, it is the society which handles this. And we do have our registry data collection every year. And as we have understood it over the years, there is an average of 8 to 10% increment in number every year. And today I would say that, as somebody mentioned, that we have more than 1,000, about 1,100 members in our society. There is an average number of procedures that are being performed in interventional radiology is more than 50,000 per year in India. So the numbers are ever growing, and I'm sure the jump will be now much more, and that's where the media will play a role. We want to reach out to the people and tell them there is this branch of medicine which can be taken and can be helping in the treatment of a lot of patients. So the growth is very rapid. Lot of new technologies, lot of new techniques are being developed, and the growth is very rapid now.
So as we have already discussed, intervention radiology is available everywhere, but the cost and the waiting list when compared to UK and US, in India it is easily available at a better price, and it's affordable, and they can reach India easily. So all the major hospitals, such as the private entities like Apollo and all these other hospitals, they are offering medical tourism and intervention radiology as a specialty to all the foreign patients. As a doctor, I have already treated many of these Saudi patients, Tanzanians, Nigerians. All these patients come down for the treatments. So it is, yes, very much available for medical tourism.
Cost is where, healthcare sometimes becomes health scare. And in fact, my friend was just, prompting me from behind and requesting me to ask this question to the doctors. You did mention cost, and you did mention the benefits of, shorter stay and keyhole surgery, or, pinhole surgery, minimally invasive surgery, all those things well understand and well appreciated. But can you give us an actual perspective of cost? How does it compare with the other alternative methods of treatment?
Okay, so I will also like to answer your previous question,
yes,
especially about the medical tourism. So in fact, we do not like the term tourism when it comes to medical science, because it is all giving care and not earning out of
Pleasure.
it, as the tourism word goes to. So apart from the corporate hospitals where the rich patients from Saudi and other Gulf countries can come and have treatment in India, but especially for cancer care, when we talk Tata Hospital, we get patients from all over countries in this part of the world. We get patients right from Afghanistan, from Nepal, Sri Lanka, Bangladesh, and they may not be very affording kinds, but they get the best treatment, best treatment at affordable cost. So that kind of medical tourism we practice. At the same time, when you talked about the cost effectiveness, as we call about this particular treatment, yes, it is minimally invasive, so it is daycare procedure. Patient do not waste many hospital days, so he doesn't lose his income or working days, as compared to other traditional ways of treatment like surgery or chemotherapy and other modalities of therapy. The patient has to undergo a long hospital stay because he takes time to recover, so he and his family, they lose their income. At the same time, because they are morbid procedures, there might be more complications. So again, the cost of other auxiliary treatment increase, that again adds to this. And as against that, with shorter stay, there is significant saving for the patient as well as from the out of the pocket expenditure for the family. So all this, if we consider together, these minimally invasive treatments, which most of them are daycare, is a big saving for the patient, and that is how they are cost effective as against other modalities of treatment.
All the state governments have incorporated now practically all the intervention radiology treatments in government health schemes. So the Pradhan Mantri Arogya Yojana, or in Maharashtra Mahatma Jyotiba Phule scheme, all of these things, Ayushman Bharat scheme, are covering up all the intervention radiology treatments to that extent that stents are also covered free for these patients under this scheme. So that way, fortunately, intervention radiology is able to reach the last mile or the poorest of the poor in the country.
Platform to tell you about this.
So, sir, can I clarify one thing? Fortunately, intervention radiologists across all metros or tier 2, tier 3 cities are available in most hospitals across the country. Though we may be small in number, but we are available everywhere. It is your right when you reach the hospital and you say, I have chest pain and I need to see a cardiologist. It is your right to ask for an intervention radiologist. If you create awareness through media, surely intervention radiologists are now not just operating, we are available for consultations also. So we are available for you to come across the table and discuss on consultations, how you consult your general practitioner. So we are available across the country. You have to ask for that.